This is a video by the Cork Traveller Visibility Group. I'm Caroline, the Traveller Health Coordinator with TVG. So this video really sets out to cover testing for coronavirus and how that has changed as of yesterday. So I'm using the latest HSC information just to try and explain what the testing procedure is and how to go about getting a test. So the first thing, as of today, GPs will ask people to identify two symptoms that they might have. One of those symptoms is a high temperature, which should be over 38 degrees Celsius. Okay, so a fever or chills is one of the key symptoms. The second symptom is either a cough, which can be dry or wet, or breathing difficulties or shortness of breath. So people, when they call their GPs looking for a test, would need to have two symptoms: a fever or chills, or breathing difficulties, shortness of breath, or a cough. So when you ring your GP will assess you to see if you do need a test. The GP will then send a message to the testing centres to get you an appointment. That can take a few days. And what you will get is a text message a few days after you've spoken to your GP with your test details, the date and time of your test, but also where that test is going to be done. It can be done in your home or it can be done in a community test centre. And there are a number of test centres in Cork City now, but you won't know where your test is going to be done until you get that text message. So while you wait for your test details, you're being asked to self-isolate. And what that means really is to completely limit your whereabouts, your movements going in and out the house, but also your contact with people, including your own family members. And that can mean staying in one room where you would take your meals and go about your day in isolation. So you will be asked to self-isolate until the day of your test, but also while you wait for your test results. And if your test comes back positive, you'll also need to continue to self-isolate and maybe get treatment at home if your condition is manageable at home, if you don't need to go into hospital. It's really important not to go to the GP or to test centres or hospitals or pharmacies unless you're waiting for a test. We've heard recently of people turning up at test centres without an appointment and having to be told to go away. So not only it wastes your time, but it also clogs up the system there at the test centres. So it's important to bear in mind that from the time you speak to your GP to when you're given an appointment can take a few days. Some groups are being prioritised for testing, and that's health workers and at-risk groups. At-risk groups are people who are 60 years of age and older, and people who have long-term medical conditions and weak immune systems, so people with diabetes, asthma, respiratory conditions, cardiovascular problems, and so on. So on the day of the test, you will be actually in the SMS or text message that you will receive with your test details, you will be given a reference number. That's your own reference number, and you need to bring that with you if you are to go to a community test centre to have the test done. Bring your reference number. The HSC and the GP don't have access to that number, only you do through that text message. In some cases, the test will be done in your car. So when you get to the testing centre, you stay in your car and the swab is taken from your nose and your mouth, and then you just drive off and you get your test results a couple of days later. You will also be asked to stay in self-isolation while you wait for the test results. That's really important. when you don't know if you will be testing positive or not. If you have any questions about the testing procedures, if you're not sure, please contact your TVG health workers or your local traveller organisations. Your GP obviously can answer some of your questions as well. But just to reassure you that the TVG is trying to support families. We're here to take phone calls. We're here to try and answer your questions as best we can. Thank you.